it's Dr. Pat with Little Critters, and we have a beautiful little bantam boy with us today. He's a well-loved pet chicken, and as you can see, he's got his tail down. He's a little droopy, feeling a little dumpy today. And if you look at this left eye, you can see that it is tearing, so we have watery discharge all around the eye. And if we look at his nostril, he's got discharge coming out of his nostril, as well as on the other side, and he's been squinting. And if you look at him straight on, you can see that the sinuses on the left are actually a bit swollen. And we'll show you this in a minute when he's anesthetized, but when we look in his mouth, at the top of his mouth, they have a normal cleft palate called a choanal slit, and it's actually packed full of plaque and debris all along that slit. And that could be all this drainage draining down in there and plugging it up. There are also infectious diseases like trichomoniasis that can cause oral plaques. So the plan with him today is to get him anesthetized. We're going to clean all of that out, do cytology, get some labs and some sinus and skull x-rays on him. As far as differentials, there are a number of possibilities. As I suggested, trichomoniasis, and then anything causing sinusitis or sinus infection in chickens, and that's a number of diseases. We always consider mycoplasma in chickens. It's a very frequent diagnosis. And then also viruses, laryngotracheitis, bronchitis. There are many other viruses that will cause chronic upper respiratory signs in chickens, some of which can be quite severe. And so we are going to test him for those and get him cared for and feeling better. You can see he occasionally will have a little bit of trouble breathing. No overt respiratory distress, but again, that whole choanal slit is kind of plugged up in his mouth.